what are the symptoms and signs of breast cancer? How can we check it? Like how we'll find out that we have a breast cancer?
Breast cancer usually we see in the age group of middle age group, that is 35 to 55, and we also see in the like old age group, and nowadays we are seeing in younger population also. That's the reason every woman should be aware of what are the main symptoms and signs of the breast cancer, so that they should know when they should meet an oncologist or when they should meet a clinician. So most common symptom what the people come up with is the swelling or lump in the breast. Something is not normal. So when they examine or when they see or when they palpate, sometimes while taking bath or any time, if they feel anything hard or anything firm, the nodule is they felt in the breast, that is one important symptom and sign when they should meet a clinician. And it is not that all those palpable swellings are all which can be felt or not cancers, but anything palpable should be like examined by the clinician and make sure that it is not cancer. If it is cancer is there, that can be prevented from spreading to other parts. Other than lump, there are like symptoms wherein there can be discharge from the nipple, which is not normal, okay? Not lactational. If the mother is not feeding, if she is having some type of discharge, it can be reddish, it can be like whitish discharge, it can be very much spotty, it can be like pus-like discharge. Any type of discharge from the nipple, it might be a sign of breast cancer which is hidden inside. Other than that, there can be changes in the skin over the breast. Just if you look at your breast in the mirror, if you see any changes in the skin, there will come the wrinkling of the skin or something type, any wrinkling or any deviation of the breast appearance from the opposite breast. These changes which are visually appeared to you, that can be a sign of underlying breast cancer. Other than that, there can be redness involving the breast or the overlying skin, that usually occurs in the late stages of the cancer. Redness and the pain is a symptom which people mistook it as if the pain is there, they go to doctor, but that is not so. Usually breast cancer is painless. Breast tumors are painless. So pain occurs only when it is very last stage or it goes beyond certain size. That time only pain can be affected. So the painless swelling should not be neglected. Other than this, there can be swelling or lump in the armpit. Sometimes you may not feel anything in the breast, there can be some swelling in the armpit. That can be a hidden cancer in the breast which is spread to the armpit, that has grown in size. That may be the symptom. And then if the breast cancer has spread to other parts, like if it is spread to bones, if it is spread to liver, or if it is spread to brain, you can have symptoms like multiple bone pains and unable to walk and loss of appetite. All these things can be there if it is spread to other parts of the body. Specifically, if it is bone, you will have bone pains. If it is spread to liver, you can have jaundice. If it is spread to brain, you can have constant headaches or vomitings, nausea. If it is spread to liver, there can be, I think I repeated, jaundice can be present. So these are the symptoms which are present and the later stages of the disease. So earlier you should look for lump, discharge from the nipple, any swelling in the armpit, any changes in the skin, and if any changes in the shape of the breast while moving the arm, or if you are lifting the arm, if you can see any dimple or any depression in the breast, that can be due to any lump inside the breast which might be pulling the skin. These are the main important symptoms and signs you should look for while to be aware of the breast cancer.